When are you starting? Mhm. Hi, Grant.
Hey.
My name is Adrienne. I'm a student physical therapist at the University of St. Mary. Is it okay if I work with you today as a student?
Yeah, of course.
Okay. Well, Grant, I have looked over your intake form, and I'm aware that you've been having some upper gluteal lower back pain, and there might have been a bulging disc that was shown on your MRI.
Yeah.
Does that sound correct?
Mm-hmm.
Okay, well, do you mind telling me just a little bit more about that?
Yeah, of course. So I've been having like this right side lower back upper gluteal pain for like 4 or 5 months. I'm a high jumper and I do run track a little bit. It's really been like affecting not just the track and sports sides of things, but like it's really hard to even sit in a classroom all day, and I'm in high school, so I don't get up very much. And kind of like you said, like the MRI, it said I had a bulging disc, which I did some looking online, and on WebMD it says it's a pretty serious problem, and I don't really know if I'm gonna get any better. It doesn't sound like it.
Well, I'm sorry, that sounds very traumatic, and it sounds like it's been having a pretty significant impact on your life. So do you think you could tell me maybe a little bit more about, sort of how it's affecting your outside social life with like school and everything? And
Yeah, it's definitely affecting like my grades, my social life. My back just hurts all the time. I can't focus in class. I can't go out with my friends. Like last week, there was a football game on Friday. I can't sit in the bleachers for that long. It hurts way too bad. I'm not sleeping really at night anymore. Like the pain wakes me up in the middle of the night, and I can't sleep through the night. But it's just it's really leading to a very like stressful and anxiety-driven life that I'm kind of living right now, and I'd like to get fixed.
yeah, again, that sounds like it's been having a pretty significant impact on your life, and I'm really sorry to hear that. So do you think that, you said you're having a little bit of sleep issues. Can you tell me a little bit more about, how your sleep hygiene is, if you've ever heard of sleep hygiene?
Not really. I can tell you how I'm sleeping. I'm not well. I wake up multiple times in the night. My room is always hot because my parents don't turn down the thermostat. I don't like noises in my room, but I have to have a fan because it's so hot, and I try to cool it down a little bit. I know that's important. My 2 family cats kind of sleep in my bed. I live upstairs, and that's the only room that they ever go in, so they kind of sleep with me, and they wake me up sometimes too. So I don't sleep very good.
Okay, so sounds like, I know that you have a tissue issue for sure, but it sounds like that you might be having some sort of pain issue, which is kind of where your central nervous system is sort of overly sensitized and kind of reacting to pain. So the good news is that we can actually fix that. So I know that you have a bulging disc, and that sounds very scary, but the good news is we can really solve that, because most of the time, since you're very young and fit and you're an athlete, a lot of times you get a bulging disc, which it sounds, and you look at the MRI and it looks scary, but it's really not too bad, because most of the cases, in 9 months, the bulging disc actually shrinks in 50% in size. So we can definitely work on that. So I just want you to kind of look at this picture. Can you tell me kind of what this picture kind of represents to you?
Yeah, that looks exactly like my MRI on the left. I'm in anatomy in high school right now, and we're kind of learning how like all of the fluid in between these vertebrae gets squeezed out, and it pushes up against whatever this thing is, and that's causing my pain, right?
Yeah, it looks like that from like when you see the MRI and you feel like looking at that image, you're like, oh, that's kind of what's causing my pain, and for sure you definitely have a tissue issue, but I think kind of your central nervous system is just on high alert, and we can definitely work on that. I also want you to kind of look at this picture, because I know you were telling me about some other issues that were going on. Can you tell me what this kind of represents to you?
Yeah, this is definitely my body, and an alarm maybe going off. That might be my pain. This stuff on the right definitely makes me think of how poor I've been sleeping, like the last 4 or 5 months. I'm not too sure what this is over here, but am I right? Would you mind explaining it to me maybe?
Yeah, so you're actually right on the dot. This is kind of sort of your body, and this is kind of signifying your pain, and this is kind of your alarm going off because you're experiencing all this pain. This is kind of the signal that's getting sent to your body, and these are sort of all the other outside factors. So I know you said you've been having some bad sleep hygiene, which that makes sense. You know, you're supposed to have sort of that cold environment when you're sleeping, and not a lot of whole outside noise, so that makes sense. And this is kind of just your home life, so this kind of could be, you know, your relationship with your family, or it could be, you know, you might be experiencing that stress from not only your family but your coaches and sort of your school life too. All that kind of contributes. So yeah, that's kind of what I wanted to focus on, is like I want us to focus on your tissue issue, but also sort of that maladaptive pain responses that you have. I feel like you have a lot of stress, and your sleep hygiene is one of the big main maladaptive pain behaviors that you're displaying. So right now I want us to actually go over, and I want us, have you heard of myofascial release? So it's a technique I want to try on you. It's kind of something we'll use for just a large area of your tissue and kind of help spread out that tissue. So can we go over to this table?
Yeah,
over here? I'm just going to go ahead and start kind of on this lower back area, kind of where your pain is, because it was on the right side, correct?
Yep.
Okay, and you just let me know if it's feeling okay, okay? All right. Is that feeling okay? Yeah, I feel like you have a lot of tension right now. Do it one more time. All right, Grant, I'm gonna have you go ahead and get up, get your shirt back on.
Okay, thank you.
All right, so I just wanna wrap things up a little bit. I definitely wanna continue in our next session with doing our myofascial release, because I know it's definitely, there's a tissue issue going on, but definitely wanna continue with our pain neuroscience education.
Yeah.
What do you think about that?
I think that sounds great. I think there's a lot of things in my life that are contributing to the pain, and it feels nice just to have somebody to talk to it about.
Yeah, and you can always, you know, talk to me if you have any concerns. You know, I'm always interested in what you have to say, and if you ever feel like this, what I'm doing with therapy-wise is kind of maybe not helping you as much, or if you think you have something that you'd rather like to try, I'm always open to suggestions. And I look forward to working with you. And thank you for working with me today.
Yeah, thank you.
All right, have a good rest of your day.
You too.